do that dressing a little bit later, closer to the end.
When researchers looked into cancer survival rates among First Nations people, an alarming picture emerged. Canadians from those communities had a lower rate of survival in 14 different cancers, including colon, breast, prostate, and leukemia.
Differences in screening could play a role.
Lorraine Merritt was the lead scientist on the study.
We should be alarmed that there's a subgroup of the population that is doing so much more poorly after they're diagnosed. You know, there's one more disadvantage. We hear about the disadvantages all the time, and here's one more.
One stark statistic was for cervical and ovarian cancers, where the 5-year survival rate was at least 20% higher among non-Aboriginal women. Many factors can explain the difference in survival rates.
One could be they're diagnosed later. Another could be that the treatment that they get is suboptimal. Another could be that there's differences in how well people are in terms of other diseases.
It's alarming, it's appalling, it's so upsetting for me.
Dr. Lisa Richardson is an Indigenous health education researcher at the University of Toronto.
Hi, Maureen.
She says there's a long history of health inequities among Canada's First Nations people.
People feel that they may not seek healthcare or have the same experience of healthcare as non-Aboriginal peoples because of their experiences of marginalization, racism, stigma within the healthcare system.
Although the authors of the study say more research is needed to explain these findings, one solution they say should be easier access to screening programs for some cancers that could lead to an early diagnosis. Cass Rusi, CBC News, Toronto.